Chrissy?
Hi.
Hi, Chrissy. I'm Louise. I'm going to be your videographer today. Why don't you come into my room? So, Chrissy, I have to ask you some questions, okay? Can you give me a full name, middle initial, and date of birth?
Sure. Christine A. Nielsen. And 3-4-73.
Okay. And have you removed everything off from underneath your Johnny from the waist up?
Yes.
Do you have any piercings or tattoos I need to know about? You did take off your bra and all your jewelry? Okay, good. So I have to ask you a personal question. Is there any chance you could be pregnant?
No.
Okay. And have you ever had this kind of x-ray before? Okay. Look, I'm going to be taking 3 x-rays of your upper back. Is that where it hurts?
Yeah.
Okay. It's called your T-spine. Okay, so your upper spine, I'll be taking 3 views in all. Okay, you'll have to lie on this table. It's a little hard. It's really uncomfortable. I can prop you.
Okay.
Do you have any questions?
I don't think so.
Remember, with back and neck and hip, people are in a lot of pain. We'll show you a system. I'm going to be taking points off of that too. I want you to be able to assist them according to their injuries. So I'm going to have you sit right here on the table. I'm going to take this away. I'm going to have you lie down. Let me help you down. Okay. I'm going to have you slide towards your feet. A little bit more if you can. Put some leg shield around you. Is that better?
Yeah.
Okay, Chrissy, what I'm going to do, straighten out a little bit. I'm going to ask you to bend your knees and put your feet flat on the table. How's it feel?
Yeah.
Feel better? Your arms right by your side. Center the IR to the CR. 1417. I'm going to come in a little bit on that wall. How you doing? Okay? You back okay? Disability. All right. So take my here, and I'm just going to measure. You bring your chin up just a little. Good. I'm going to go up a little bit higher. It's really small. Give me a little bit more neck. I'm also going to come in. What'd they say, 7? Yeah, it is 7. Okay, never mind. I was crabbing about them for nothing. Just in the light feel right up in the right. Ooh, sorry.
Is it my hair?
I'm kidding. Chin up just a tad. That's good. Okay, Chrissy, I want you to take in a deep breath and blow it all out. And hold it out. Don't breathe. And click. You can breathe. Now I'm going to ask you to roll up on your left side.
I was trying to help out.
This is the eager patient. I'm going to put your head on this.
Okay.
And just face that wall. Bring your chin down towards the table a little. No, turn. That's it. You gotta go somewhere in between, but I don't think that's gonna work. Try that. Just don't want you to tip. Can you bring the shoulders down towards your hips? That's better. Up again.
Would it be better if you put it the other way?
Which way? This way?
Then at least like it's not tilting.
No, that would be on her.
No.
Good job, Sarah. Does that bother you though?
No, it's okay.
Okay. Bring your arms up a little bit. Bend your knees. I'm gonna push your butt forward a little, okay? I know. Can you feel that?
Yeah.
Does it hurt a lot?
No, it's
Can you
okay.
feel like that for a bit? It'll just get numb in a minute.
It'll just get numb. You won't feel it. It's all good.
She's on her greater trochanter, and actually, when you rock them a little bit and you know you're there, I mean, you're gonna feel that on thin people. Larger people, not so much. You kind of know that the hips are on top of the other. Okay, so before I do anything else, I'm gonna just make sure she's nicely lateral. I'll rotate this. That's good. And then I'm gonna check for sloping. A little bit. Let's try this one, only because it's squishy. Alright, so lift your hips up a little bit, and back down. Better? Good. Okay, so let's say that the collimation for this is going to be 9 to 10, okay? Not 7. You guys. Mid coronal. Inch and a half to 2 inches above the shoulder. Okay, good. And then the last thing, I'm not sure they don't come that much. Just like we did for the vitiligo rectum. Just up to the shadow. Let me just look at her up here. Can you see? You want to come over here, Sarah? Can you see the?
Yeah, I can see it.
Looks good. Good. Okay, Chris, just breathe normally. Just slowly, normally. Good, you can breathe normally. Just relax, it just stayed like that. I'm gonna change my eye. I forgot my marker. So this should have been a left lateral. Demure it. Put it in the corner here, probably in the upper corner, least likely to be in the way, in the light. Okay? Now, I just want to show you, if I was not going to pack, what I would do is I would angle 10 degrees.
Do we have that option in Zen?
Yes, you do. What I need to see is that, I need to know that you're checking it though. Okay? Just don't automatically do this, because in some cases, you don't have to do either. If their back is even, because their hips, waist, and shoulders are in the same plane, which happens to some people, you're not gonna have to do it. So the point is that you need to check to see what you're, if you have to do either or, pack or angle, and maybe not. And it doesn't have to be a large person either. It can be a very small person with just sort of, you know, not much of a waist, but it's all in the same plane. I should say not much of a waist. And you're going to come back to center where you were before. Actually, you might come down a little bit lower since we're coming up here, but. The left marker up in the corner at his shoulder. And I would do breathing. Is that good? Let's see, you can lift. before I ain't here. Freaking me out. You're gonna have to actually slide down your feet a little, 'cause I'm not gonna be able to. Okay, good. So when you're doing so on a table that's a little limited like this, when you're doing upper body, have them slide down to their feet so it gives you full range, so you're not gonna run out of space. When you're doing lower body, do the opposite, and it'll give you the same. So this arm down by your side, this one up. Yep. Okay, you're still tipped a little bit. It's okay. Maybe down a little bit more. That's gonna come up, but let me check down. I should have brought it up. I don't know if I could have, right? Was I all the way? No. I was all the way. I could have come up. Okay. So now I'm going to use 11 by 14, 14 lengthwise. Can you bring your chin up a little? Okay. Basically for this one, what you're going to do is I'm just going to skim her shoulders. So you should almost come up a little. Remember when we did like the partial flexion elbow? I told you to come up just a little to get through the thickest part. The same kind of here. You want to skim the shoulders. Actually, you want to try to get to T1 is where you're trying. T1, T2, but just looking at her shoulders, skim the shoulders. Make sure she's nice and straight. Put the marker here. Now for trauma, it's really important that you get the light field to the middle of the ear at least, because they have to count. Remember when we looked at like trauma laterals? You can't really count always from the bottom. You can't tell which one is C7 sometimes because it's close to T1 and it has a long Spreng's process. So you have to be able to get the base of the skull. For this one, if it's just a pain T-spine, you don't so much, but you're going to keep it at 14, and you can come in a little bit to, oh, wait a minute, I'm at 14 here. This is 11, so come in a little bit more like to 9, because she definitely doesn't need all of that. And I want to be mid-coronal, and I want to see skimming her shoulders, so not too much you tipped. Good. Okay, let's shield, marker.
Do you need the lateral shield again on this one?
Oh yeah, we do. Can I use that? Not real. I don't think they have you do it, but let's do it.
The rubber mat thing?
Yeah, because we're not really in, like, the reason we do it is that this is such a thick area, and we're going, you know, we're going mid-coronal, but sometimes a little bit posterior. So there's flesh here that will absorb scatter. There's nothing here that's going to absorb scatter, so you want this to absorb scatter. And do that on the swimmers as well, although there's not as much scatter. And if you have an 11 or a 10 and that's what they want you to do, that's fine too in clinic. And this can be done breathing or expiration. I think most people will do expiration. But okay, Chrissy, so taking a breath, blow it out, and reach for your toes, reach for the ceiling, or yeah, good, and collect. And if you can breathe.